the repeat.
Recording is in progress. This is a reminder that don't say anything you don't want recorded or spread on the internet. I'm Jim Kreider. I am the treasurer of APA, running the beginning of this meeting, and then I'll turn it over to Kathy Blake to run the content. Maybe that's not the right word, the healthcare part of this meeting. Sure. Do we have new members or people attending for the first time here? Anybody online? Nope. Okay, welcome all.
Oh, somebody raise your hand.
Representative McCormick.
Representative McCormick, good to see you.
Welcome.
Welcome. We will, Representative McCormick and Senator Nicholson, we will have a timer, right? There she is with her timing devices, high-tech timing devices. Please keep your eye on her to let you know if you can see her from online. If you're running out of time, well, I noticed. Marvelous. Do we have, besides our two featured speakers?
Lindsay's up there.
Yeah. Lindsay, how are you here? Or you just posted your picture to pretend to be here? It's clever.
Sorry, didn't say my
Welcome,
name.
Lindsay, it's muted.
Oh, nope. Sorry, I'm here.
Yes.
I'm running late, so I was like trying to get on the Zoom, but I am here now.
Okay, hi.
Hello.
And you are running for Senate District what?
Yes, I'm sorry, I'm in the car, but I'm running for Senate District 19, and I'm the current state rep for House District 24. Session starts on Wednesday, which is very exciting. I'm excited to see Rep McCormick. We work really well together. So glad she's here today and to hear more about this bill. And I'm also the chair of the One Health Committee now in the House. So this bill will most certainly come to my committee. So I thought this was a great topic today. So thanks, everyone.
Great, welcome. If anybody new just came in on Zoom, if you haven't signed in before, would you put your name and email address into the chat on Zoom so we can know who you are? Welcome. Let's spend a few minutes talking about what either gives us hope or keeps us up at night. What are you thinking about?
Well, I have to say that in the Congress now, we're just 2 votes away from being able to do some things in the House of Representatives in Washington, since 2 have left, or 1 is already gone and 1 is, well, 2 are already gone and 1 is leaving at the end of the month. So maybe we can get something done if we can find a couple of Republicans that want to lead.
That would be nice. Thank you.
I want
Julie.
to say today is January 6th,
Yes.
and I think we all just need to remember what almost happened and how fragile our democracy truly is.
Thank you, Julie. Remembering how fragile our democracy is on January 6th. Anybody else? Colin.
Well, along that lines, I'll say that we'll give the hope that Colorado really took the lead with our Supreme Court declaring that Trump shouldn't be on our ballot because he led an insurrection. So regardless of how the Supreme Court ultimately rules, Colorado really put a statement out there and made with the supporters of us. So hopefully many other states will follow suit.
Thank you.
Absolutely.
Darlon, if you missed it online, Darlon feeling good about leading on taking a certain orange person off the ballot. By the way, my wife just told me as I was leaving, she was listening to a recording with Judge Ludig, famous conservative, who said he saw no good argument related to the 14th Amendment not disqualifying this man. So it'll be interesting to, and no good off-ramp, he said, for the Supreme Court to avoid the issue. So that's interesting.
Yeah, it will be interesting.
All right, in order to pay for this room, we passed the basket. If you are able to contribute, please do. If you're not, maybe next time. If you're online, you can go to our website and find a way to do that there. We now will have action team reports, starting with Allison Phipps, who is not here. Is she online? No. Okay. Allison is in charge of communication and education, and she will put out written data if we need it. Anti-war, Bruce Morrison.
Yeah.
Speak loudly or talk to the owl or both.
Yeah. I have a soft voice, so, I'll go ahead and come up here. Where do you want me to stand?
Right next to the owl.
Right next to the owl. Yeah, no.
They can hear you from there. They can't see you from there. My mistake.
Okay,
There
right
you
here.
go.
Okay. Yeah, I didn't say a lot. I do want to thank everybody that's, called, for a ceasefire in Gaza. We're just gonna keep plugging on. There's a lot of stuff going on in the world, but right now, Gaza seems to have taken a priority for us. So keep those calls, come to your members of Congress. It's okay to call more than once. They keep track. Thanks.
Thank you, Bruce.
Oh, and if you want to join, and help me send out call to action or help me decide what to do with anti-war, let me know. And, I'll put you on the list.
Sounds good. Environmental team, Taylor Jernigan.
Hi there, my name is Taylor Jarnigan. I am the team lead for the environment team. For at least another month or so, I'm going to be passing it over to Darlan back there in the corner. I've been the lead now for 2 years, I think. So I think in a volunteer organization, it's good to rotate the leadership around, and I will continue to be the Zoom guy. I consider myself to be a tech guru, and I follow the statement of that was made by I'm trying to think who it was. H.G. Wells. All right, so the statement is that in the valley of the blind, the one-eyed man is king.
Nice.
So the king is stepping down from the environmental team. That should be a model for all other kings.
But staying on the Zoom.
Exactly. Mindy Moore is not with us this week. Contact her if you're interested in affordable housing. Joyce Richardson on political action.
Just gonna be a busy year and we're gonna need everybody to pitch in. There'll be many things happening. We've got all sorts of people running in the county. We've got all sorts of people running for state offices, and I will help facilitate people getting attached to federal races, but we'll probably do more of my focus on local. So.
Can you mention what they are?
My God. Well, all of Julio just announced he's our treasurer, so all of those county offices are gonna be up. There is a county commissioner race. Rachel Zenzinger is running, so she'll be on the ballot this year. We have State Senate 19 in this area. We have House District 24. Lisa Foray is running, and I don't know who is running on the Republican side, and I'm sure there'll be a Libertarian or two. But that's what I know right now. So it's busy. And then, of course, federal all the representatives are up. And it's interesting because all three representatives for the state of Colorado to the House of Representatives, all the Republicans have stepped down. So it's open season. It's going to be really interesting. And if I can editorialize, I think Lauren Boebert made a huge mistake, but I think she's toast anyway.
Yeah.
Thank you, Joyce. Julie Callahan for Social Connection.
Yeah. Right here.
That works.
Cut them over by that.
Oh, this works too.
Yeah.
Okay, hi, I'm Julie Callahan. I'm in charge of socializing with people. We had our last book club last Wednesday, or it was our first one. I think there were 6 of us there. And it was a lot of fun. So we're gonna do another one, the first Wednesday of every month. So it will be on Wednesday, February 7th. We're going to read a book called An Invisible Thread. It's a true story about a relationship between an 11-year-old panhandler and the executive who meets him, and they change each other's lives. The books that we read will not always be political. We're going to, sometimes it's nice just to have a book that's lighthearted and fun. Sometimes we want to read books, like I would like to read a book on how not to become cynical in the world as it is today. So that may be a book coming up soon. In the coming months, I want to get with Joyce and talk about how to turn young and possibly do what we did before a few years ago, which is make some little yellow cards that talk about voting is not one day. Being part of democracy is not one day. It is a series of dates. It is a series of races. It's getting involved. I talked about city council because I had just heard from city council that maybe they don't have to be 18 to vote in local elections, which I know nothing about, but I want to find out about it because I think that's something the youth of Arvada may be very interested in getting involved in. If you want to be part of the book club, somebody told me that Facebook was not really good for RSVPing. So cell phone number there. Feel free to RSVP, feel free to show up, even if you don't RSVP. I think we'll continue to have it at the Old Town Arvada meeting room, and hope to see you there.
What time?
6:30 to 8. We'll have an hour and a half, so we're not rushed. If you read the book, great. If you don't, just come visit. Yes.
I would just like to add that it was really great. I encourage people to investigate it. I'm really glad I went.
Thank you, Gage. Yay.
And speaking of little cards, we have APA business cards on the back table if anybody wants to take a set. So when you meet new people in the grocery store or wherever or neighbors and they're interested in us, you can hand them a business card. Those are back there. And we have a new elected official or a not so new elected official who came in. Obi, you want to say hello?
Hi. Hello, everyone. Obi Zadi, City Council in Westminster. I'm running for State Senate and glad to be here. I want to thank a lot of you for the food drive donations that ends until.
Wonderful. Kathy?
Yep.
Kathy Blake is in charge of the rest of the program, and I will step aside.
All right. Thank you, Jim. Good afternoon, everyone. Nice to see a bunch of faces here. I'm Kathy Blake, the APA Healthcare Action Team leader. Our team advocates for a publicly financed, privately delivered, universal healthcare system in Colorado and nationwide. Why do we fight? Because we care. Everyone needs healthcare. We fight because of our personal experiences and those experiences of our family. Today, we're going to hear what is broken in our healthcare system, what is being done, and how you can help. I'm going to give you a brief overview of the meeting. First, we're going to have a 2-minute showing of Healing US, a movie trailer. And then Abby Griffith will share her healthcare story. Next, Representative Karen McCormick will discuss her new bill, which is 1209 revisited. She's presenting at the Colorado legislature in January. Next, we'll have Senator Jeanne Nicholson, who you may remember from last year. And she's going to focus on solution building, coalition groups and actions that you can take to help promote universal health care in Colorado. Next, we'll have questions and your stories. And then we'll have another person on Zoom who's sharing their story in the last 5 minutes of our meeting. They wish to remain anonymous. Okay. So, Healing US. There's a free showing of this movie, which is about healthcare, of course. and discussion afterwards at Stanley Lake Library next Saturday, January 13th at 1 p.m. Details are on chairs, and you online people can send an email to Arvadans For Progressive Action at gmail.com, and we'll send you the details. And okay, a couple other events. January 20th, we're having our next healthcare action team meeting on Zoom. And February 7th is lobby day at the Capitol. Details following later. Next time. Okay, the handout also includes how to share your healthcare story online. If we don't get to all of them today, or the people have paper there and a pen, you can write your healthcare story, put it on the paper provided. Healthcare stories will be shared with legislators and others if you give permission. Okay, a little bit more about our speakers. State Representative Karen McCormick has 33 years of experience as a veterinarian in the field of small animal medicine and surgery. She has over 16 years of experience as a successful business owner for 16 years. Since 2020, she has represented District 11, which is Longmont, in the Colorado State Assembly. Senator Jeanne Nicholson is a master's level registered nurse. She served in the Colorado Senate from 2011 to 2015. Prior to serving in the Senate, she was a public health nurse, a school nurse, and a home health nurse in Gilpin County, which is a rural community near Denver. She's currently the president of Healthcare for All Colorado Foundation. Our first speaker, Abigail Griffith, is a professional landscape architect. Her career focuses on the design of sustainable public places and restorative landscapes. She has lived in Arvada for 10 years and is the mother of 3 young, adorable children who I met. Okay, an important note here. Take care of yourself as we're listening to these stories and things. Some of them may be disturbing or intense. So if you find yourself getting activated or agitated, take some deep breaths from your belly, push your feet into the floor, maybe squeeze something, and do whatever it takes to calm yourself. I also want to acknowledge the courage and resilience of all those who are sharing their stories and those who are engaged in the fight for better healthcare for everyone. So Taylor, why don't we start with the movie trailer?
My daughter, Jeanne, went to the emergency room with my husband. And, the first thing they asked her when she got there was, "Do you have insurance?" And Jeanne replied, "No." This sealed Jeanne's fate.
If me and Danny lived in Canada, if me and Danny lived in Mexico, me and Danny would still be living in Canada or Mexico.
One of the hardest parts was talking to the insurance collector because he even broke down in tears. He couldn't believe that he was having to call me to tell me that I had a bill because my baby had died.
The Democrats and the Republicans are both in the pockets of Big Pharma and the insurance lobby.
It's not just one of the parties that's been corrupted by corporate money. It's both parties.
The main reason why we're not where we need to be is because of money in politics.
Ultimately, everything's about the dollar bill, right? So when you have Big Pharma, when you have these mega health insurance companies who basically write the bills for our politicians, of course, it's a conflict of interest. It shouldn't happen.
We pay more in America for our healthcare than almost anybody in the world for worse results.
This is a profit-driven business. Make no mistake in that. And they are duty-bound. They can be sued if they are not acting in the best interest of their shareholders.
The fallout is that they would rather make a sale than take care of a patient. The people in this country know the system is broken.
Medicare for All, with 88% of Democrats and 49% of Republicans and 70% of Americans overall, is an American policy.
We can make this heavy political lift. We can do this.
Stanley Lake Library. Abigail? Oh,
How long is the movie?
oh, it's, an hour and 15 minutes. And then there'll be a discussion afterwards.
No problem. Here, hi everyone. Hello.
No.
I don't think I've met any of you before. I've met Kathy. Thank you, Kathy. Speak with you guys, and yes, thank you, APA. I am the Michael Griffith, Michael for Arvada. You know, usually whenever he starts to talk, he always is thanking me for being at home and watching our kids. So it's time for me to thank him for being home. And I think my son, my middle son, was crying when I left, so I'm sure he's not having a great time. But yeah, so I've never really told the story. I told Kathy the story. I've never really shared this publicly. It's not something that I really talk about. It's, you know, I never really thought it was of interest, so I'm happy to share it with you guys. So let's see. So about 10 years ago, I was diagnosed with a blood clotting disorder called prothrombin 2210. The thing about that blood clotting disorder, there's many types of blood clotting disorders. If you take hormonal birth control, it makes you 16 times more likely to have blood clots. And unfortunately, at the time, I didn't know that because I had never been diagnosed with it before. Now, I'm not here to talk about, you know, hormonal birth control and if people should take it or not or anything like that. That's not what I'm here to talk about. But I do think that our healthcare system does us no service whenever we're allowed to take things that could cause us to potentially die. So with caution, I suggest people, I don't know, to take hormonal birth control if they want to. But anyway, so 10 years ago, I was in my 20s. Not to age myself too much. Just kidding. I went to Planned Parenthood like a lot of people in their 20s did, and I went to go get some birth control because that's where I wanted to go. And I had health insurance. I had Kaiser Permanente. So I had a job, I had insurance, I went to Planned Parenthood, I did all the right things. I think I even donated to Planned Parenthood while I was there. And I got my birth control prescription, and I was taking I think it was the NuvaRing at the time. It was like the brand new hip drug that everybody wants to take. And so that's what I went for. And I don't remember how long I was taking it or how long I was using it, but it was a little while. And it was the event, everything that happened started just one day at work, and I'm a landscape architect, so I'm on the computer drafting, making a beautiful landscape, hopefully. And all of a sudden I realized that like my head's not working right. I'm not able to perform the way I usually perform. I can't type in commands for the program I'm using. Well, I'm just not thinking right. So I'm texting Michael and like, I don't feel right. I don't think there's something, I don't know what's going on with me. And, at some point we were texting back and forth. I'm like, I can't even text right. Like, I don't even know what I'm doing. So, I said, I'm going home. I don't feel well. Maybe I have the flu. I don't know. So I get home, I drive from downtown to, I think I lived in Lakewood at the time. So a little bit of distance. Yeah, I did live in Lakewood, sorry. I was like, kidding. And it just gets progressively worse and worse. And I'm trying to use the restroom. So I can't function. I can't use my hands. I'm in my 20s. I don't know the signs of anything at that time. So Michael comes home. He's like, I'm going to come check on you. And he's like, no, we're going to the hospital right now. And I was like, oh, I don't know. I just don't feel good. Yeah. So, this comes, we're going to the hospital. I'm like, oh, I got Kaiser Permanente insurance. Where do I go to the hospital? I know that I have to go to special places for this type of insurance. Where do I go? I didn't even know. So we ended up going to the Lakewood Clinic. And Michael runs in. He's like, I think we weren't married at the time. My girlfriend is having this problem. We need a hospital. Can we come here? They're like, no, you need to go to Swedish. So we ended up driving really far away to I don't even know what part of town that is. It's way south. And kind of talked to the lady at the front, and she's like, oh no, you come right on back. So I'm in the emergency room. I'm laying there, we're telling the nurse who's kind of greeting us what's going on, and they immediately put me on what they call stroke watch, which is pretty serious. And they're like, all of a sudden all these staff come in and they're poking with me needles, and I think there was maybe some blood that splattered from an emergency IV that happened. There's doctors asking me these complicated questions about clocks. I don't really know what's going on. And in that emergency room, what did we do? We did the emergency IV. They did a spinal tap, which was pretty interesting. Never done that before until then. And then I had a CT scan, and they just couldn't figure it out. So they admitted me to the hospital, and I stayed there for a week. I was in the neurological section because they figured out it was probably had to do with my brain. And while I was there, I slept most of the time. And I told Kathy, I don't even remember if I ate a meal or anything. I don't know what was happening. I just think I slept most of the time. And they kept on doing MRIs on me, taking me back to do those. I think they were pretty much daily, to kind of look at different parts of my brain and really figure out what was going on. Because I use the analogy of it's like a house episode, that show where something's happening and they don't know what's happening, and they have to they get into the conference room and they're trying to figure it out. So in my mind, that's how it was, which sounds way more exciting. Anyway, at some point they found what they called a bright spot in my brain, and they zeroed in on it with some, I forgot what's called, whenever they can, I can't remember what's called. I'm not even gonna try. And they were able to diagnose what they call cerebral sinus thrombosis, which is a blood clot in your sinuses, the sinus veins of your head. So I can't remember if it's the one that goes in or the one that goes out, but it was serious, but not as serious as it could have been, which was good. Shortly after they diagnosed me, they were like, okay, well, we know what's happening to you. You're out tomorrow. And I'm like, what? What is going on here? I just had this traumatic event. I've been here for a week. I thought I was dying. I'm sitting here thinking, oh gosh, this is the end of my life. I don't know what we're doing. They ended up taking what they call a blood panel. They started me on blood thinners right away. And shortly after, I did find out about the blood clotting disorder, but for all they know, they didn't really know why I had a blood clot. They didn't know what was going on. They suggested that I stop taking NuvaRing because they suspected that could have been the issue. And they put me on warfarin or Coumadin, whichever one, I can't remember which one's the generic version of that. And which was, as a 20-year-old, what is this? There's all these specific rules about what you can eat, what you can't eat. Got to go to get your blood drawn every week or days, depending on what part of the treatment you're on. And yeah, going home was hard. I mean, I felt, really scared. I had a lot of panic attacks. I got to take some time off of work. I was very lucky. My boss told me, don't worry about it, take some time. You don't have to use your PTO, just take the time we'll still pay you. I was like, okay. And, I took some time and I would just be laying there before I went to bed every night. And I'm thinking, oh God, like I could die tonight. Like, I don't even know, like all this blood clotting, all these warnings about the warfarin, about bleeding out. Like, what if something happens? And I was just like super scared. And it was really hard. I really wish that they would have, maybe kept me in the hospital for a few more days, like process everything that was going on. Now we get into the whole billing affair, which, if anyone's had a major medical event, they're pretty ridiculous. I think we calculated the final bills to be about like $200,000 worth of things that they did to me. That included like all the MRIs, the stay. I think Michael checked the bill for like how much it costs every time they gave me like a Tylenol. It was like $80 or something ridiculous like that. And, after a month or two, they start giving you the bills and like, this is one bill, it would be nice if it was one bill. This is what you pay. That's all you do. No, like a bill from the lab, there's a bill from and then there's the hospital stay. And so, excuse me, it was just a lot. And, I had, at the time I was young, I had a high deductible plan. And I think I was supposed to pay out of pocket like $20,000. And I'm like, oh, at least it's not 200,000, but it's still quite a bit. I was at the beginning of my career. I wasn't making a whole lot of money at the time. And, Michael and I, we were trying to make ends meet. So it was really hard. We did end up paying it over, a long period of time. We were able to do that. So that's good. But, sometimes we had trouble making the payments and things would, come back a few months later with like a different colored paper, which means that you're really in trouble. So kind of navigating that as, a young person who's never dealt with anything, it was just really hard. Kathy also wanted me to talk about a little bit, it has to do with my blood clot disorder. I've had 3 kids. Oh, thank you. I have 3 kids. And since you have elevated estrogen levels when you have 3 kids, or when you have a kid, just one, I didn't have any multiples of you have to take a blood thinner, and it's not like Coumadin or warfarin, which is actually pretty inexpensive. It's called Lovenox or enoxaparin sodium, which is one of those top tier drugs, right? So even though you're supposed to, through insurance, they say, okay, if you're pregnant and you have this, existing condition and you need to have something for the pregnancy, even if it's a top tier drug, we'll bring it down to whatever the lower level is, and then you can get it affordably, right? Well, no, they never got the coding right. No one ever could figure it out. And, so my first pregnancy, it was like, for 30 days, it was like $100. And I was pregnant for a lot longer than 30 days. So it started to get really expensive. The second pregnancy, somehow something went right with the insurance, and it was really affordable. And I was really thankful for that. This last pregnancy, it was astronomical. It was like $200 and something for like a 60-day supply or something ridiculous. So it's, navigating these drug plans and what you have and what you should, be paying for certain problem. It's kind of a whole big mess. And that's kind of, I had to take those medicines because if I didn't, I'd risk my children. So anyway, that's my story. Hope you guys got something out of it, and hopefully it helps I got fired up.
Thank you, Abby.
Yeah,
Yes,
no
thank you.
problem.
Thank you, Abby. Good job.
Well done. Thank you.
Okay. Thank you for sharing.
Yeah, no problem.
And now we'd like to hear from Representative McCormick about how to, we all care about this. Now we want to do something about it.
Thank you, Kathy, and thank you, Abby, for sharing that story. Can you all hear me okay?
Yes. Yes.
Okay. Because it was a little choppy on our end, so I wanted to make sure we're coming through from the Zoom world. This, as many of you know, there was a bill last session that was House Bill 1209 that many of you are intimately familiar with, that did not quite make it across the finish line. So this bill that I'm bringing forth with Representative Basenecker, Senators Marchman and Hawkins Lewis is that exact bill with some improvements and modifications. The way, and I just wanted to, I know that Senator Nicholson had some slides. I may not need those slides, so Jeanne, I'll leave those for you for when you talk. I wanted to just let everybody know an overview of how this bill came about, where it is now, and the process ahead of us. So I think you gave me about 15 minutes or so. So back in 2019, there was a bill that came through the General Assembly that directed the School of Public Health to actually do it was a task force for them to look at 3 different systems and to compare those systems. The current Colorado healthcare financing system, they were to look at that where residents receive their healthcare coverage from private insurers, just like we heard Abby talk about Kaiser, and most of the rest of us might be on some other kind of insurance payment system. To look at that compared to a multi-payer system where there is some publicly funded and some privately funded payment systems, and then to compare those 2 systems with a third payment system, which would be a universal payment system, kind of with a single payment system that would still provide care through private healthcare providers. I'm going to need to drink something. Hang on. So in that analysis, that was House Bill 19-1176. They discovered that indeed at a 60,000 foot level, the healthcare system, nonprofit, publicly funded kind of single payer system, by leaps and bounds, saved this state money and everybody in it, and was able to cover everyone. So after that bill, discussion was had about, do we go to the ballot now? Is it time to go to the ballot and ask the people of Colorado again, should we do this? Because you also all probably remember Amendment 69 that also didn't pass the finish line because there were a lot of unanswered questions. So I think it was a very smart strategic decision to go to this step, which is more of a granular, detailed study that we are tasking the Colorado School of Public Health to go much further than they did before to find out what a universal healthcare system could look like here in Colorado. What would the impacts of that system be on our healthcare workforce? What would the impacts be on individual and community health? Where are the gaps in our current healthcare system, and how could a single payer system address those gaps? There are over 350,000 Coloradans that do not have health insurance, and about twice that are underinsured. And, even just hearing from Abby, even if you think you're fully insured and have a good job and you have a good payment, if something happens to you, being able to afford your whatever deductible you signed up for or your maximum out of pocket can be really a burden and put many people in dire financial straits. So this bill will have the School of Public Health obtain a model piece of legislation. That's a draft. And that model piece of legislation has to come from a nonprofit group in our state that has made it their mission to prioritize what we consider the 10 tenets of a system such as we're going to describe. And it will provide these comprehensive benefits to everyone from both medical care, dental, hearing, vision, and mental health. It will look at the potential for providing long-term care and support services to all residents, at least at the level of what is available to those that already receive medical assistance for these things. It will require that the healthcare decisions of patients are made by the patients and their provider. Let's get back to the doctor-patient relationship and make sure that they're in the driver's seat making these decisions and that it's not a third party entering in and deciding what care you need and what they're going to pay for, which is super frustrating for every human being on this planet. It will allow patients to have free choice among providers that are participating in this universal payment system so that you won't just have your list that is never updated on who you can go to under your insurance payment program. It will provide these comprehensive healthcare benefits to every single Colorado resident. And we went even further in this bill to define who a resident is, which will include people that are temporarily out of state or the folks that intend to make Colorado their full-term home. So, our college kids that go away would still be under that system. The system will be funded by each individual's ability to pay, very much like Medicare is now. Depending on your income, will dictate kind of your premium, if we want to call it that. It will prohibit deductibles and copays. So the system needs to be funded at a level where the things that we need covered are covered by that financing stream, and that the providers, the hospitals are paid not just adequately, but fairly. So I have quite a few doctor friends, not veterinarians, medical doctors in the human field that are so fed up with the system that they are working in, and they themselves talk about how much our healthcare system and their ability to help patients this is not what they went into this field for. The ninth thing is that this payment system will be publicly administered through a nonprofit enterprise set up in the state. That will be the agency that pays for these healthcare costs directly to the providers. And it will be designed to prioritize benefits and access to care for patients and prevent those barriers that so much of us have encountered. The kind of the second, so that's kind of the premise of what the School of Public Health has to find a model piece of legislation from a group that has all those things as their tenets. There's another whole list of things that the School of Public Health must look at. Generally speaking, we want to make sure that they can identify those health expenditures by payer so that when we have constituents, I have so many constituents in my area, and I know that you all in Arvada may feel this way as well. Like, what does this mean to me as an individual? And as a business owner, I know that they mentioned that I owned my own business for 16 years. it was very frustrating to me to also be a middleman, a middle person between my employees and their healthcare. I was making the decision for them. And I, as a business owner, really didn't want to be doing that. And I shouldn't have been doing that. So my employees had me and health insurance companies between them and their doctor and their care. And this is where we, 50 years ago went astray. So we also want to make sure that they give us a good idea of, as I mentioned, an individual's ability to pay and what that would look like. Describe how this payment system would interact with federal and state law they're currently in existence, the services that are covered under Medicare, Medicaid services and benefits that may meet or exceed the current services, and make sure that the provider reimbursement rates are equivalent or higher than those current Medicaid reimbursement rates. We want to make sure that coverage for women's healthcare services and comprehensive reproductive healthcare are present in this, that are covered in this system. And we made sure to put the wording in there that are allowable by state law, since Colorado has made great advances in making sure that we have comprehensive reproductive health care here in our state, and we're not sure what more might happen at the national level. So we did change some wordings from last year's bill on that. Again, I mentioned vision, hearing, and dental services, behavioral health, substance use disorder. So many questions that need to be answered. That we are tasked, I call it a huge homework assignment for the School of Public Health. And they are very excited to take this on and really want to do this deep dive so that we, not only at the state legislature, but the people of Colorado can have the answers that we seek. And it will set us up for if and when we're ready to potentially take another ballot initiative to the people of Colorado, we will have a strong, firm foundation that we can stand on, and we'll be able to answer the questions that we're not able to answer when Amendment 69 went up and was defeated. So the other part of this bill creates an advisory task force that has, thank you for that time reminder, that the advisory task force has, I believe, about 24 members on it that are strictly in an advisory role. We wanted to make sure that there would be no way for any kind of blockade to the homework assignment that we're giving the School of Public Health to get their work done and to come up with a report. The advisory task force is comprised of legislators, hospital associations, people from labor, disability, community, reproductive rights, doctors, mental health providers. We have a Tabor tax expert on there, for rural healthcare, nurses, homeless coalition folks, dentists, just about everybody you can think of, LGBTQ community, pharmacists, employers. We want to make sure that if the School of Public Health, if and when the School of Public Health needs to consult on their homework assignment, that they have a robust group of folks that will be able to give them feedback and advice on completing their assignment. So I'm excited about that part too, because we really put a lot of thought into that. And I wanted to thank the Colorado, all the nonprofits that have been involved this summer in the working group that's been working so hard. And I know we're so disappointed when this bill did not get through last year. Process-wise, this bill is my pre-file bill. So what that means is that the final draft has to have been done by last Friday, which it is, and it will get introduced early in session, I think by the January 15th. And until it's introduced, by the speaker, we won't have a bill number for it. So as soon as I have a bill number, you all will have a bill number, and we'll be able to start kind of referring to that bill number. I'm really happy that Representative Doherty is here. She is the chair of the Health and Human Services Committee. I serve on that committee. And she's right that most likely this bill will go to that committee. It did last year as well, which is helpful because this is not a brand new idea, brand new information. We have incredible support in the State House and the State Senate to get this across the finish line. We're looking at potentially a new fiscal note for this bill over last year's bill. The School of Public Health has asked for, I think, a little more time than they had in last year's bill. And we had robust discussions this summer and fall too about, we want to make sure they have the time that they need and they have the resources they need to make sure that the homework assignment that we're giving them is done in a complete and thorough way. So I look forward to seeing what the fiscal note accompanying this bill will be. And all of we're doing a lot of outreach to various groups to get endorsements of this bill and to organize folks to show up to testify in favor, hopefully, of the bill. And I'm just really excited. I'm incredibly hopeful. I want to get this in and out of the House over to the Senate. We've talked to the chairs of both appropriations committees in the House and the Senate, and have gotten a very positive response back about its ability to get through. It's really we're gonna be looking at our budget. So it's all about the budget this year, the long bill. We don't have as much money as we had last year. So the fact that we've also added into this bill the opportunity for gifts, grants, and donations will allow us to potentially explore needing to fundraise to be able to pay for the school public health if the legislature can't fund the whole thing. So, but I'm going for the whole thing. I'm going to push for the whole thing. We did add that part in the bill to make sure that that's not going to be a barrier for us to get this done. So I'll go ahead and stop there. And I know that I'm going to stick around for your whole meeting. So just let me know if you want to take questions now or when Senator Nicholson is done. Thank you.
Thank you very much. Oh, I should be
We're
over here.
ahead a little bit. Can we ask questions?
Do people have questions? Or do you want to wait? You guys want to wait until later?
Let's wait.
Okay. Thank you. I guess I'm over here now. Thank you very much, Representative McCormick. That was interesting and exciting, and we're all waiting to see what happens, and the bill will anxiously await the next bill number, the new bill number. Okay, so now we're up. Senator Nicholson.
Thank you, Representative McCormick. We are thrilled that you are in the state legislature and a champion for universal health care. It means a lot to us who've been working on this for many years to have you as one of our most important partners. So thanks for being you. Thanks for what you're doing. And thanks for being so knowledgeable about the issue so that we know every day at the Capitol you're going to be representing our best interests on this issue. So I'm going to start with a slideshow. My first point is to let you know that to pass this healthcare analysis bill that Representative McCormick has been describing to us. We need Representative McCormick's and Representative Basin-Ecker's and Senator Hawkins Lewis and Senator Marchman's help. And they actually need our help. Next slide. My slides from Taylor? Okay. So what we know now is that the majority of Americans, and indeed the majority of Coloradans, believe that everyone should have access to comprehensive, affordable health care. But next slide, what we're not clear about is exactly how to get it. We that healthcare is not affordable for some of us. It's more expensive than it needs to be, insurance, and that people are needlessly suffering, people are dying, and people are going bankrupt. So we need to change our system, and we're there yet. Next slide. About a week ago, one of my neighbors came over just for a visit on my front and she's been working for over 30 years in one of the big hospitals here in the Denver area and commutes down from our home in the mountains. And I said, you know, what's it like now for you to work in healthcare? And she said, it's awful. It's horrible. I go to work and I'm frustrated all day, feeling like I can't give the quality of care that I want to give for my patients. I leave the hospital knowing there are things that I needed to do for my patients, and I simply didn't have time to give them the care that they needed. That is not why I wanted to be a nurse. I have satisfaction, not because of the pay, but because of the feeling that I'm actually making a difference in my patients' lives. And I'm not feeling that satisfaction anymore. She said, I can hardly wait until I can retire because it's so frustrating. I spend more time working on paperwork at the nurse's station, filling out some form saying how many 4x4s I used in a dressing change than I spend with my patients that I'm supposed to be taking care of. And the last thing she said to me was, my advice to you is don't get sick. What we now call this in our field of nursing and medicine is moral injury. That is not only horrible, that our patients are not getting the care that they should have, and that some people aren't getting any care at all. It's also really horrible for the healthcare providers. So next slide. So what's the solution? Well, next slide is to pass the 2024 healthcare analysis bill that Representative McCormick was talking about. Next slide. This bill will direct Colorado School of Public Health to do the analysis and include predictions about the social impacts of a single payer plan. It'll direct the School of Public Health, next slide, to include the 10 essentials services in the plan if it is possible to have a publicly funded plan in Colorado. The 10 essentials that Representative McCormick was laying out for you. It'll create a 25-member task force to provide advice to the School of Public Health. The task force, advisory task force, will be made up of these 25 people, President of the Senate Majority Leader, Speaker of the House, next slide, and the Minority Leader of the House, each appoint one member of the General Assembly. Next slide. The governor appoints one person representing hospitals, another organized labor, disability, community, reproductive health, physicians, nurses, mental health, state tax law, rural health, homeless community. The task force appoints one person representing healthcare's consumers, dentists, historically marginalized communities, lesbian, gay, transgender, bisexual, pharmacists, small and large employers, and healthcare policy and financing departments, the commissioners of insurance, the chief executive officer of Health Benefit Exchange. So what's the timeline? The timeline is, next slide, July 1st of 2024, the School of Public Health would begin the analysis. By August 1st, the advisory task force would be appointed. And by May of 2024, the legislature might pass the bill and the governor might sign the bill. Next slide. Before October 1st of 2025, the task force would meet at least 6 times. And by October 1, 2025, the School of Public Health would submit the report to the General Assembly, and December 1st, 2026, the law would be repealed. So that's the process that the School of Public Health and this advisory committee will go through. One point that I wanted to make about the task force members is that if you have suggestions of someone that you think of who might want to serve on this task force and would be willing to do so, then you can submit names to Representative McCormick so that we might have some influence on who those task force members are. That there's no guarantee, but it would be a recommendation, and she's open to hearing from us any suggestions. So, next slide. How can we help? What part should Colorado citizens play to get the healthcare analysis bill passed? Our job as advocates is to communicate effectively with legislators and the public. Next slide. Next slide. Our job as advocates is to build a strong coalition of like-minded organizations, especially ones with lobbying power. And for that reason, Kathy and I and a number of other people have been recruiting organizations to belong to a coalition who will join us in advocating for this legislation. Next slide. Next, we need to speak with our state representative and senator and take part in Lobby Day. That was mentioned earlier by others. And Lobby Day, if you'll make note of this, please, is Wednesday, February 7th, 7:30 in the morning. We'll start in the old Supreme Court chambers. It will be a great opportunity for us to be at the Capitol together. Some of us will be wearing red berets, and we will be talking to our legislators about why we need to get this bill passed. The other step that we can do is what Kathy was talking about earlier, host a neighborhood gathering to show the American Hospitals documentary or Healing a Broken System. Not only having them in public forums, but also in your neighborhood is an excellent way to spread the word about why we need to change the way we finance healthcare and make it not nearly as difficult as it is right now. And we need to also write letters to the editor. Next slide. And so what should we say to our legislators and to the public? Bottom line, next slide, is to tell stories. Tell stories like the one you heard from Abby. Those are the most powerful. I promise you that what you will remember the most from what we talked about today is her story. These stories stay with us the longest. They're what motivate us, and it's the reason why they are powerful when we are speaking to other people in the public and to our legislators. You should not limit your talk to facts about access to healthcare. Next slide. You should be talking about ideas, about problems, about solutions to healthcare financing methods right now. And if they're embedded in stories, they are much easier to remember. My 10-year-old granddaughter was diagnosed with severe anemia, and we were taking her to Children's Hospital for blood transfusions every other week. And one day when we were there, the pediatric hematologist said, I'd like to start Hazel on a drug, but I need to get permission from the health insurance company in order to pay for this medication. It took them a long time to get that permission for my granddaughter to get the drug that she needed, not because it was not medically appropriate, but because it was expensive. Should my 10-year-old granddaughter need to wait and deal with every other week transfusions while they were trying to figure out how much money they wanted to spend on her or not spend on her? So we should also be asking questions. Should commercial health insurance companies be making a profit, or should healthcare be publicly financed with no profit? Just in the background, because we're running out of time, just keep in mind that many people on the campaign trail will say, you know, we believe in competition and the free market. And so that's why we should have all these different insurance companies. And the response to that suggestion is that healthcare does not fit into the free market principles. One of the basic principles is that the buyer has to be knowledgeable. Unless you went to medical school, sometimes you just aren't knowledgeable enough about some challenge that you're dealing with your own health. And so you can't be shopping around. You didn't have time to go shopping around when you were threatened by a severe stroke, it sounds like to me. That's nonsense for us to say this fits into the free market. Another is that the seller can have no other interest. In this case, the seller clearly does. All right, let me just finish up. So America financing right now is made up of these 8 pools that are listed. What we're suggesting is that we could be in one pool. And if we were, it would be administratively far less expensive. And we would make sure that we were able to cover everyone and that the quality of life for all of us would be far better if we all had excellent health care. Right now, we're wasting significant amount of money. We're being told that we can't afford to cut pharmaceutical prices because that's how they finance their research and development. Next slide. Next slide, sorry. One more. And that's not true about the pharmaceutical companies. Most of the money for the pharmaceutical companies is spent on lobbying and on advertising. This is one of my favorite slides. This shows the growth of administrators in the United States in healthcare in orange compared to the number of physicians over time in green. What is wrong with that picture? So can we create a Colorado-owned healthcare plan? Next slide. Keep going. Can we create a way for our families to have healthcare security? Maybe. What we need to do in 2024 in the legislative session is to get this bill passed. We need your help to pass the healthcare analysis bill and answer the question, can we create a Colorado publicly funded healthcare plan? Next slide. So just a reminder, we need Representative McCormick and Representative Basenecker's support, Senator Harkins Lewis and Senator Marchman's support, and they need our help. Can we do better? What are you going to do to ensure your family has healthcare security? As we like to say in the West, saddle up. We're burning daylight. I'll leave my contact information up there if you want to contact me later. Thank you.
Thank you very much.
You're welcome. That was
Excellent, well done.
Thank you.
Okay, so now we have some time for questions and yeah, questions, stories. And if people have seen the movie, Healing US, what your takeaways, what you found compelling about the movie.
I have a question from the chat, two questions. When we get to question and answer, will behavioral health benefits have parity with medical benefits? That's question number one. And what was meant if a public benefit is possible in Jeanne Nicholson's presentation?
Do you want me to answer that?
Yes.
I can answer both of them actually, if you want me to, Jeannie. So as far as behavioral health, mental health care, absolutely yes. There's no reason why we should treat our brain health any different than our heart health. And so, and what's great about this potential payment system is if providers aren't running up against adequate reimbursement rates and red tape and paperwork, that we might actually be able to get more providers into the system because we're short providers. But who wants to go into a system that's so convoluted as ours? So yes, parity with mental health and physical health. And then the if, my interpretation of the if in the slides is that's the whole reason for this bill, is that we need answers. We all are, you know, those of us that support this this payment system, the single payer, not-for-profit payment system, have a pretty good idea that this is where we need to go. This is going to work for us. But what we need is the data. We need the proof. And so we're saying if, because we are waiting for the data, we're waiting for the proof, and we want to make sure that we have it before we decide to go further with the incredible effort that and the expense it's going to take to bring a ballot initiative to the ballot. So the if is accurate because we really want that report to come back and prove it, and then we can get rid of the if. Go ahead, Jeannie, if you wanted to say more.
I would just add that one of the best ways that you've described it before, Representative McCormick, is we want to know if our grand idea is feasible on a very practical level. Will our government, or will our Colorado laws allow this? And will the federal laws allow this idea that we have? And that's what we're asking the School of Public Health to do, is to, we know why this is a good idea. Now we're asking, how do we do this? Can this be done?
Thank you. Other questions? Paige? So
If you have questions, if you could come up to the owl to speak, that will help the people at home here.
Stand here.
Yeah, that would work.
Okay, so I just have a real quick story. In October, I broke my wrist in a fall, and I was in New Jersey, and I was calling the orthopedic place in Golden to get an appointment, and they got me an appointment. This was like Friday. They got me an appointment on Monday, and they said, but you'll need a referral from your primary care doctor. So my primary care doctor, I called them, and they couldn't until Thursday. And I couldn't just go in and say, please give me a referral to the orthopedic place, because in order to update my health insurance, they needed to give me a full physical, and they didn't want to make a separate appointment for that. So I had to wait, and then I called Panoramic back and got another appointment for like the next Wednesday. So I waited about 2 weeks with a broken wrist.
Oh my God.
And when it's like, it's broken. X-rays showed it wasn't just a fracture. It was like, out of whack and
Out of
plate and surgery and everything. I had to wait about 2 weeks when I got back to Denver for the surgery because of all this back and forth.
Terrible.
That was crazy.
That's terrible. Yeah.
So I have two questions. Does the feasibility study include some sort of a look at the attraction of people outside of Colorado moving to Colorado if we become one of the first states that would put this kind of a plan in place? I think that was one of the pieces that made the ballot initiative a few years ago a challenge, is people had trouble getting their heads around that. So I would assume there might be a way to do modeling that might take a look at that. And the second question is, what is your best guess on whether or not this will get through? I think Democrats still control both of the houses, so I would have thought this would have been an obvious thing that would have been, it makes sense to do a feasibility study like this. What's your best guess as to whether it'll get through?
Let me answer the first one and ask Representative McCormick to answer the next one, because that's a really good question. For Representative McCormick. When we expanded Medicaid, when I was in the state Senate, we did not see any unusual increase to Colorado in order to take advantage of that coverage. When we asked experts in Canada what happened when they passed universal health care in Saskatchewan, did people from the other provinces all say, oh, I'm moving to Saskatchewan? No. What happened was they put their hands on their hips and they said, we want what those guys have. We think that that is what will happen, that we need to tell that story. And it's not likely that people will move here for this one reason. We think people move from one state to another to be closer to family, to get a new job. There are lots of reasons, because we have gorgeous weather, lots of reasons why people move to Colorado. We don't think that this will be a huge problem for us based on those two experiences. Representative McCormick, what do you think about the chances of this getting through with you having control of both houses and the governor is a Democrat?
Well, first, I want to say that the more diverse group of people you get that are supposedly all under the same tent, the more likely it is that you will have, you will start with some infighting. So we've gotten so big. It's not a bad thing. I mean, I wouldn't want to be in the minority. But just saying that we have 46 Democrats in the House and what is it? Anyway, in the Senate, they have like a 2-person majority, and having the governor being a Democrat does not, we are still very deliberative on each and every piece, I hope we are, of policy that comes in front of us, this included. And we were elected to really do our job and dive into each piece of legislation. We have not allowed some Democratic bills to get through because they weren't well worked. They weren't well stakeholdered. They would potentially cause harm and unintended consequences. And so I just wanted to address that, because I do get that question a lot, that you have a supermajority, it's a trifecta, like just get stuff done. And most of the time, a lot of our stuff does get through, and 88%, I think, of our bills are actually bipartisan, which tells you that we are doing the work, we're building relationships, and we're asking all the questions. I am incredibly hopeful on this bill and very optimistic that it's going to get through, because it almost did last year and it didn't not get through because of not having the votes. It was a calendar issue of timing and where it ended up in the Senate. And that's why making the very conscious decision to have this be my pre-file bill out the gate first, get in and out of the House over to the Senate, so that we don't end up with running up against the calendar with our only 120 days of being down there. We've talked with the governor's office. We're in conversation with Senate folks. So everybody's ready. I think we've greased the wheel and we're ready to go. I'm incredibly optimistic, but that doesn't mean that everybody just sits back and relaxes. We need your voices. If your own House Rep Dougherty and your senator are already on board, awesome. Don't stop there. Reach out to your neighbors in other areas and get support.
We do, we are out of time. And we have one more thing going on. Thank you, both of you, for the questions and the answers. And the rest of you for the questions as well. And now we have one more story from Jane Doe. Are you there?